of Lagos,
There is still a poor level of
Be the first to know. From the north, south, east, west, and around Africa, we break the news.
One Nigeria.
Now you can catch all the actions live as the news breaks. We are Core TV News,
welcome to Core
a
TV.
24-hour news station.
All right, good morning and thank you for joining us on Cool Digest. It's a really beautiful day here in Lagos, especially as Nigeria waits to be cleared by the WHO as indeed Ebola-free. Now, quite a lot of good job done by the federal government in collaboration with medical practitioners, especially when you see the fact that this is not only a local or continental challenge. Even countries like the US and Spain are also battling the Ebola fight. Well, unfortunately, not sounding too good. You'll recall that 2 months, just a few weeks ago, the NMA called off their 2-month-old strike. And just last week, Thursday, another medical group by the name NUAP, I believe that is National Union of Allied Medical Professionals, also declared an indefinite strike. I'm joined now on telephone by AK, AK Chinodi, right? And he's the Southwest Chairman of NUAP. Good morning, AK. Thank you for joining us on the program this morning.
Hello.
Hello, good morning. Are you there?
I'm there.
Okay.
Also, my chairman is also here now.
Your chairman is also there now.
Yes.
Okay, please, can we speak? Who would you want us to speak with, you or your chairman?
Okay, any of us.
Okay,
Let me give him, since he has my superior.
let me just start with you, AK.
Okay.
As at Thursday, we understand that the national strike declared by your own union, the National Union of Allied Health Professionals, did not affect the delivery of medical services in public hospitals in Oyo, Kwara, and Lagos states, even in the Federal Capital Territory. Why the poor compliance?
Well, it's a bit poor compliance because sometimes when we start strike, it takes some people to get information earlier. Some things, some were waiting for issue, but later they have got a clear cut instruction by the National of Allied Health Professionals, and these are the things we are agitating for. That was why there was no complaints at the fourth time, at the fourth day. But after that day, the compliance began to increase. It is up across the nation now, and if you go to most of the hospitals, it's called there's already compliance.
It's all right. Just clearing the coast as regards who and who are involved in these strikes. Which professionals really are under the umbrella of NUAP?
The radiographers or also cosmetic scientists, the medical advanced scientists, the physiotherapists, the pharmacists, the social workers, the senior medical health information officers, the dietitians,
Okay.
and speech therapists. All the professions that I'm led to.
It's all right. Let me just confirm if nurses are part of the union. Are nurses part of you?
Nurses are not part, nurses are part of issue, like they belong to now, but they are not part of NUAP.
Okay. Are we probably looking at a house divided against itself? Because I understand the NMA is not part of this strike, nurses are not part of this strike, and several other health practitioners across the country who are also saying they are not part of this strike. What is responsible for that?
Who are not part of the strike?
The NMA and the nurses, obviously.
The enemy is an application of their own. They are brothers, but the NAM is also a union of their own. The enemy is not a union, it's an association. The
It's all right. We also understand that the strike took effect few hours after the resignation of the Minister of Health. Is there any relationship between your strike action now and the minister's resignation?
I'm getting that strike, please. I didn't get the question right.
Okay. I said we understand that your strike action was reported to kickstart after a few hours after the Minister of Health, Onyebuchi Chukwu, announced his resignation. Is there any relationship that exists between the two?
Really, we are happy that the minister has resigned. Alas, thank God. It's a good news. We thank God for that because actually, as far as we are concerned, its impact on the health sector is lopsided. So his resigning is a good news. But we actually scheduled this strike not before this time. All we'll be waiting because the Ebola issue came, the Yanya bombing came, so now we delay all this time. But we discovered that the problem was just very tiny. Since January to this time, they reached an agreement, they would not live up to their responsibility. So this was why it is high time we call the spade a spade. It's unfortunate that I think the minister had it out of he resigned.
It's all right. What exactly are the issues? Because the NMA just came from a 2-month strike, and we understood to some extent they talked about residency training, they talked about, you know, the consultancy status and several other things as regards, you know, several other issues that has to do with remuneration. But for the National Union of Allied Health Professionals, what exactly are the issues that motivated this nationwide strike action?
But the issues that are on ground were all the agreements reached under the umbrella of JOHESU with the federal government. And when an agreement is reached, obviously, because the two parties to abide by the agreement. For instance, we have been on the issue of the laboratory interns, which is there. We have the problem of the leadership and the restructuring of the health sector. We have also the problem of we talk of who is a consultant and who is not really a consultant. Some of these things have been reached. Some of these agreements have been reached with the government. We are only expecting them to rule out the circular. Now, no circular, only a memorandum of understanding. So we are saying, each have been here, rule out the circular that touched all the agreements that have been reached.
It's all right. Let me speak. I understand that the Lagos chairman is over there with you. It's all right. Hello, good morning, Mr. Chairman.
Yes, good morning.
Yeah, for the purpose of proper documentation, can we have your name and your designation?
My name is Comrade
Christian
Christian Ikechukwu.
Ikechukwu.
Christian Ikechukwu.
Okay. Okay, you're the Lagos chairman of NUAP.
Yes.
It's all right. It's all right. The Southwestern chairman was just talking to me about the reasons why your union have decided to go on strike. What is the role of JOHESU in all of these? The what we know as the umbrella body, the Joint Health Union, because we understand that that particular union is not a party to this ongoing strike.
All right. Thank you very much for our questions. I want you to know exactly that JSU is a working arrangement made by all the unions under JSU. And my union is one of them. Ever before we went on strike, the JSU at their last meeting, the last but one, decided to give government 15-day ultimatum. That ultimatum expired before the last Muslim festival. Who were supposed to start the strike, but then Ebola issue came up, and of course some of us are Muslim faithful. So they pleaded that on their political day. Many others. We agreed, and within that period, government equally gave us notice, I mean, just now, to have a meeting with them. This week was dead. But before the meeting, the last agreement was up to 8 seconds that are supposed to come out from the areas or issues agreed upon in the past. You will agree that we, by the time we come to that meeting, it will be visualizing these circulars, doing corrections in some of them that we are out before, and then of course, with circulars we know that we have started something.
Okay.
Now we can be sure of having concretized whatever agreement we had with government.
It's all right.
We're not talking about the Minister of Labour issue.
Okay.
Our situation has health and labour to the Secretary of the Federal Government of Nigeria, that is Chief Pius Ani. So, so we believe that whatever say that we have agreed upon, ties with seculars, up to the highest peak of decision. Unfortunately, in that meeting, even a single secular was received. Even the areas where we have some consultants being, who is the consultant? And the person there, I'm personal support, in the respect. Speaking of constraint, then the issue of restructuring the board of holding bodies of health institutions.
Okay. Obviously, Christian Ikechukwu. Hello, are you there? Let me just hold you there for a while, because obviously the issues are many, and we really appreciate if you can join us in our live studio subsequently to discuss all these issues. But we have to round up this segment now. Let me quickly quote to you what the public relations officer of the University College Hospital in Ibadan said. He said that health services, of course, were not affected by the strike, but he also added that the workers, talking about your union, were only impatient as their demands were being considered by relevant authorities in the health sector. Given the myriad challenges, the fight against Ebola, the condition of health services across board, would you say that this strike action is timely and in line with the welfare of the average Nigerian?
My dear, I will tell you that we are more, my union is more human in reaction than any other union in Nigeria. We have done a lot, even during the issue of child care. We shared our fight because of the feelings of Nigerians. The issue of Ebola, equally when it first started, we shared our fight because of Ebola. We have been more responsive to the feelings of Nigerians than any other body in Nigeria. I will say that. But the issue is that we know exactly that administration is life, it is a continuous process. If there is no issue today, you don't think that there will be no issue tomorrow.
It's all right.
We continue sharing our faith because of issues that come up like this. And of course, we believe that government would have understood if we try to put into our fight actions.
It's all right.
But they never responded as we did. We are saying, as it is, that in as much as these issues are critical, to sign Nigerians and even us, okay? But the Nigerians should please
It's all right, Kristen. Please let me just hold you there. We expect that you'll find time to join us here in our live studios in the course of this week so that we can. It's all right. We'll find some other time to discuss these more extensively. Kristen Ikechukwu, thank you very much for finding time to join us, the chairman of NUAP Lagos. And of course, we spoke earlier also with the Southwest chairman, AK, who always, of course, discussed with us the reasons why the National Union of Allied Medical Professionals are on strike. It of course, moved from non-commencement of what they call residency training program for health professionals, as well as non-implementation of new call duty allowance and several other issues. Now, many have asked the question how much or how far this is going to take us, especially in the health sector of the country. You recall that I asked him about the relationship that exists between this ongoing strike and the resignation of the health minister, because there were reports that they showed some excitement. Health workers under this union showed certain excitement following the health minister's resignation, blaming him for the underdevelopment of the nation's health sector. WHO is expected to certify Nigeria as Ebola-free today, but how do we intend to manage these with the ongoing incessant strike actions in the health sector? The enemy just came from a 2-month strike, and now we're talking about the National Union of Allied Medical Professionals. He also told us earlier, because I asked him which professionals actually are covered under this umbrella, and he named folks like medical laboratory scientists, pharmacists, physiotherapists, occupational therapists, optometrists, dietitians, medical social workers. The list also ranged towards clinical psychologists, dental therapists, and quite a number of others. And you and I know the importance of these professionals in health provision across board in Nigeria. Of course, we're hoping to be joined by the NMA Vice Chairman in the course of the show today to find out their own involvement in all of these. But reports reaching us says that the compliance this Monday seems to be kind of wider than what was experienced on Thursday. And there are also issues arising from whether the JOESU, the Joint Health Union, is also going to join in this ongoing strike. What way forward for the health sector in Nigeria in the light of incessant strikes here and there? And the same issues boil down to unfulfilled agreements that have been entered into between these unions and the federal government. Last year, ASU was on strike for close to 6 months, and of course, ASU in an amazing 10 to 11 months of strike action. What role exactly would this play in development, national development, especially in the health sector, especially at this time when the world is greatly fighting the deadly Ebola virus? We hope to be joined by this gentleman subsequently on the show later this week, and so that we can also have a representative from the government to find out their point of view. We'll take a break now, and when we come back on Call Digest Monday, we'll be looking at the ceasefire deal, and as we count down to the much talked about release of the Chibok girls. You'll recall that the federal government says that it is negotiating with the Boko Haram group, and they have signed a ceasefire deal, and that's of course very exciting news for many concerned Nigerians who felt that we have come a long way in these unending insurgent attack on our dear country, and that this might just be a right step in the right direction. Unfortunately, less than 3 days after the report of the ceasefire, there are reports of insurgent attack in some communities in Borno State. We'll be joined by a retired colonel in a short while on the show to discuss more at length on that issue. Stick around and don't go away.
From time immemorial, women have birthed life, shaped character, and by extension, influenced the society. Moremi of Ife, Emoten of Benin, Queen Aminat of Zaria, all women of influence and power.
Whether it's before election, after election.
How ironical. Women being so powerful, yet have few grounds in decision making.
They see you as a wife, and I see you as a wife to a man.
We are talking women in politics.
A woman will be bold enough to stand up and say, I want to become president of Nigeria.
Only on Core TV News.
Core TV News, expanding your view.
Glad to have you join us on another edition of The Political Arena, the most detailed and incisive political show.
If you are a sitting governor and the opposition is able to stomach structure against you, that means you are wicked to the people.
Until the end of our time, I'm the legitimate authority to govern this country.
They gave me 20 minutes to move or they will shoot me.
He has no chance for survival. If he likes himself, this is the best time to get out before he perishes.
The PDP as a ruling party has failed.
So anybody who thinks that government will fold his hands and allow miscreants to take over the streets of Osun State and cause havoc is deceiving himself.
The good, bad, ugly, and beautiful sides of the Nigerian political system. Join me every Sunday at 9:15 p.m. on Core TV News.